Good morning. Hello, everyone. We're going to go ahead and get started. Welcome to the AMA Steps Forward webinar series. Before we begin, we want to remind you that this session will be recorded and will be available after the event. You can use the audience link you joined with today or view later when we publish it on YouTube. You can download today's slides as well as additional resources we reference in the additional resources widget on your console. Follow today's presentation will be open discussion where we can address any questions you may have. Submit them using the text box on your console, and we'll get to as many as we can at the end of Dr. Sack's presentation. So without any further ado, let's get started. Hurricanes, droughts, floods. We're hearing more and more about extreme weather events. They're becoming more common, and countries, communities, and even businesses are making commitments and implementing changes to address environmental concerns. Healthcare is an industry that has tremendous impact on the environment. Given our population's heightened attention to climate change and its impacts, many on patients, clinicians, and employees will expect their healthcare facilities to maintain an environmental sustainability program with environmentally friendly policies and practices. What can physician practices do to play their part? Today, Dr. Sack will tell us a little bit more about how physician practices can address environmental sustainability within their organizations. Dr. Sack, I turn the floor over to you.
Thank you, Michael Tutty, for this introduction and also for your personal dedication to the American Medical Association's Step Forward program and to this CME presentation. Thank you also to Mr. Alexander Sayers and his team at AMA for Steps Forward and for the technical support for this program. Today's program is something different, environmental sustainability in your medical practice. Today, we're going to share with you free resources that are easy to use in your practice, ideas for saving money that will be enjoyable for your practice, enjoyable for those working with you, and I hope create a healthier office. My name is Todd Sack. I'm a gastroenterologist in Jacksonville, Florida. I'm a clinical associate professor at the H. Wertheim College of Medicine in Miami, past chair of the Environment and Health section of the Florida Medical Association, where we developed a lot of the resources I'm going to be talking about today. I've been a delegate to the American Medical Association's House of Delegates. I'm currently president of Physicians for Social Responsibility, a national organization that deals with the existential threats to mankind: global climate change, nuclear weapons abolition, and environmental toxins, and PSR is shared in 2 Nobel Peace Prizes. I speak to you today as Executive Director of the My Green Doctor Foundation and want to stress that I have no financial disclosures. And of course, full transparency is important. I want to add that the American Medical Association has no financial relationships with any of the services I'll talk about in this talk, no sponsorships, no partnerships, and no endorsements. Now, this talk is not about climate change, but climate change is always the elephant in the room when we talk about sustainability. And I want you to keep in mind the health threats of climate change and the imperative that mankind abandon fossil fuels for energy generation. This is a picture of my town, Jacksonville, Florida, after a minor hurricane in 2017. The goals of this webinar are for you to understand the components of environmental sustainability and its benefits for medical practices and for communities, to be aware of free resources available to practices to save money by going green, and to be able to initiate an enduring environmental sustainability program for your clinic or office. So what is environmental sustainability? It's the responsibility to conserve natural resources and protect global ecosystems to support health and well-being. But I really prefer the U.S. Environmental Protection Agency's definition of meeting today's needs without compromising the ability of future generations to meet their needs. So this slide describes U.S. healthcare as having the highest per capita greenhouse gas emissions and toxic air pollutions of any nation. On the horizontal axis is per capita gross domestic product by nations. And on the vertical axis is the per capita healthcare sector greenhouse gas emissions in kilograms of carbon dioxide. And what you see that when you look at the amount of air pollution and the amount of toxins produced through our industry that the United States stands out as a far outlier, producing far more toxins to deliver healthcare. And U.S. healthcare emissions are rising about 5 to 6% annually. So we got a real problem here. And our offices and clinics and hospitals have environmental impacts. The U.S. healthcare industry on the whole is responsible between 5 and 10% of America's greenhouse gases and air pollutants. And if you look at the air pollution produced by the burning of fossil fuels for the energy that we use in our industry, that the health impacts is over 400,000 years of lost life annually in the US alone, just from the healthcare industry. And this tells us also that there's going to be a health dividend for us from our environmental sustainability and climate change efforts. As we rid ourselves of fossil fuels as the primary source of energy, as we green up our economy and our practices, our communities will be healthier. Now, outpatient care itself, our clinics and offices, about 26% of healthcare's air pollution greenhouse gases. There are millions of healthcare offices worldwide. I think there are huge opportunities for physicians to save resources and money, and as role models will influence the choices made by our patients. When we are using energy wisely, when we're recycling, we're making other wise choices, our patients see this. And finally, we have the ability uniquely to reach climate vulnerable communities with messages about climate change and their health. So looking in more detail at healthcare's greenhouse gases by service type, you see in the upper right that our big hospitals are 36% of the greenhouse gases and air pollution. But outpatient care is important as well, with about 26%. Other components including retirement and nursing home care, 6%. The prescriptions we write, 10% of our industry's greenhouse gases, other services, and then construction and manufacturing, 11%. I want to take a few minutes to talk about some key sustainability concepts. These are concepts that you're going to see in the medical literature or that may be important to your understanding of these issues in the years ahead. By the way, this photograph is a picture of the waste from one ophthalmology operating room for one morning in one hospital, just enormous amounts of waste. The topics I want to talk about including topics that are specific to hospitals, important if you're hospital-based, understanding what's called greenhouse gas emissions by scope type, looking at the life cycle or cradle to grave greenhouse gas emissions of the products we use, and finally, the problem of plastics. Okay, first topic, healthcare contributes to climate change, looking at the role of hospitals. And this slide is to show you, to make you aware of the topics that are being considered by our big hospital systems. In the upper left, energy use for heating, cooling, lighting, and water use. The operating room itself, which is extremely wasteful, both in use of products and also these climate warming anesthetic gases. Meat production and food transportation, looking at how we can choose to use less meat in our cafeterias, in the food we serve on the plate in the patient's room. Employee commutes, can we encourage wise transportation choices such as ride sharing, mass transportation, or make electric vehicles easier to use by our employees? The choice of vehicles in the fleet of the hospitals themselves, looking at the supply chain for the products we buy, especially pharmaceuticals, waste hauling, waste treatment, and landfill gases. These are some of the topics you'll hear about on your hospital sustainability and climate change committees. Topic number 2, assessing greenhouse gases, but by what's called emissions by scope type. So we talk about 3 types of scope of emissions. Emissions from the on-site combustion of fossil fuels, if your office or your hospital burns fossil fuels, say, to generate heat or power in the facility. Scope 2 emissions are the emissions to the atmosphere as a result of the electricity that we buy for heating and cooling. And finally, Scope 3 greenhouse gas emissions are the emissions involved in the products and services we purchase, such as product manufacturing, packaging, transportation, and disposal. And I want to show you one example of this across our healthcare sector. This is 2018 U.S. healthcare greenhouse gases broken up by emission scope type. And you look at the bottom, you see scope 1 emissions. Those are the fossil fuels burned on site. That's a fairly small role. Scope 2 emissions are the emissions, as I said, from the power we buy from the utility, the electricity, for example. And actually, that's a very small role. It turns out the scope 3 emissions have the largest impact on air pollution, climate change, and health impacts. These are the products we buy, the foods, the pharmaceuticals, the chemicals, the medical devices. And you're going to see on talk about greening the supply chain. It's about understanding the greenhouse gas impacts, the air pollution impacts of the products we buy, and how can we do better. The fourth topic I want to talk about is the life cycle greenhouse gas emissions of products, or looking at the cradle to grave emissions. And this is an example of a study by Jody Sherman's group at Yale that looked at just one product, laryngoscope handles, and compared the greenhouse gas emissions of using reused laryngoscope handles versus ones that are single use. And on the vertical axis is the life cycle greenhouse gas emissions per use in kilograms of carbon dioxide. And what you see, LLD represents the greenhouse gas emissions of a reused handle that's reused using low-level disinfection, compared to a reused handle with high-level disinfection, the next bar graph, and then using full sterilization. But compare that with single-use devices, single-use plastic being the first horizontal gray bar, or single-use steel devices. And you see, just by going to a reusable product, we save an enormous environmental impact of a product. And you multiply this over the whole of healthcare, we see opportunities for enormous saving. But this requires work. It requires work of studying these products, looking at the environmental impact, and also looking at the financial cost. And this is the kind of work that people are beginning to do around our industry. And lastly, I got to talk briefly about plastics. This sort of scandal that there will be more plastics in the oceans than fish by volume in 2050. This is a slide from the World Economic Forum that looks from 1950 to 2014 at global plastic production. And you see an enormous rise in millions of tons between 1950 and 2014. In the upper right is a harbor clogged with debris, much of it plastic. And the lower right is one of these enormous fields of plastic across the Pacific Ocean. And these fields of plastic now exceed the size of France and Germany combined across the ocean, something we just have to begin to deal with in our industry and in our society. Okay, missed one here. How do we achieve environmental sustainability? First, in healthcare in general? Well, by saving energy in our buildings. And if you're lucky to work in a LEED certified building, a building that ascribes to the standards of the U.S. Green Building Council, leadership and energy environmental design. If you're lucky to work in a LEED certified building, wow, how nice. These are energy saving and they're just delightful to work in. By embracing renewable energy, if you have a suitable roof for your clinic, gosh, install solar panels. It's a great saving for you. With environmentally wise product purchasing and use, through re-engineering of our products, what we've talked about already, the life cycle analysis or the cradle to grave analysis of our products, by learning to reuse and to recycle, with healthy food choices, choosing local, sustainable, plant-based, and less red meat diets, with healthy transportation choices by health professionals and our patients. And when our patients see that electric car in the parking lot, they admire it and they emulate our decisions by buying healthier chemicals, particularly cleaning products in our offices and our hospitals, and by prescribing pharmaceuticals wisely. And I do want to tell you about a few really valuable sustainability resources for hospitals for those of you who are hospital-based. Healthcare Without Harm is a decades-long organization, a nonprofit that helps hospitals around the world with two resources, the Practice Green Health Program and the Healthier Hospitals Initiative and the American Hospital Association's Sustainability Roadmap. Ask your hospital CEO, are they a member of Healthcare Without Harm? Are they working on some of the AHA's Sustainability Roadmap resources? If they're not, encourage them to get started. They're going to save money and help your organization. The topics are things like eliminating solid waste incinerators and mercury devices, choosing energy use wisely, and even selecting renewable energy, waste management, reuse, recycling, packaging, plastics, greening the hospital supply chain, dealing with those climate warming anesthetic gases to minimize their use and release, transportation choices for the patients and for the staff, food choices, and even climate advocacy that many hospitals now are engaging in their community and even at the national level. Okay, let's now get more into the weeds about greening medical practices. I want to begin with some of the often heard barriers to going green, that this isn't our mission, that we're just too busy, that it's going to be too expensive, that there's no one to lead us, that our practice leaders are not interested, and that we simply don't know how. These are the barriers we're going to overcome in the next 10 or 15 minutes with the resources I'm going to share with you. You're going to be able to overcome all these in just a few minutes. Well, begin with what are the benefits to practices going green? Always lead with the benefits. That it fosters wiser uses of resources. It saves money by lowering overhead expenses, can create a healthier work environment, encourages teamwork, improves job satisfaction. And I've been to so many meetings of clinics where I see the smiles on the faces of members of the clinic team who are so pleased to work in a job that's dealing with the topic of sustainability. It may attract higher quality colleagues to the practice, can enhance the office's public image, and maybe even improve the trust of our patients in the medical advice we give them as they gain more confidence in how we look at their world. We can decrease air pollution, water consumption, and waste, and finally, the bottom line, to build a healthier community. Let me give an example. This is a sustainability success story. This is the Escambia County Health Department, which has 5 offices in the Florida Panhandle, including even an HIV clinic. They've been saving energy every month since they embarked on their sustainability journey. They began the first year with 5.2% electricity saving. This represented 125,000 kilowatt hours of electricity per year, 85,000 metric tons of carbon dioxide that wasn't released. The bottom line, they've been saving $14,000 annually without any overhead expense. This picture on the right is an example of solar panels that they put on one of their main buildings a few years ago, using the savings they gained through sustainability and the resources I'm going to talk with you about in a few minutes. I want to say a word about green teams. I'm opposed to them. So what is a green team? A green team means taking maybe 3 or 4 people in the office who are interested in sustainability and kind of segregating them to maybe have a meeting once a month to talk about what a clinic can do. I've seen so many scores of green teams fail because a few people can't attend the meeting, interest peters out, and it doesn't sustain itself. If you want to have a successful environmental sustainability program, include the whole office. I'm going to tell you how to do that in a few minutes. So no green teams. Let's make this something that the whole office, the whole practice does, and that they can all feel proud of together. And I want to encourage you to make environmental sustainability one of your core values for your practice, for your clinic, together with other values that you consider so dear, like providing outstanding health care, respecting and dignifying everyone in the practice, listening to your patients, HIPAA compliance. Well, why not add as a small but important one of your core values, environmental sustainability, environmental stewardship? It's when you begin from a leadership level of making sustainability one of your core values that you're going to be successful and reap the benefits of sustainability. So let's talk about the resources. I've been doing this for about 20 years, and these are, I think, the 3 most important free online resources for practice managers and for physicians. First is from the Royal College of General Practitioners, their Green Impact for Health program, which has wonderful modules on a number of topics that you can use in your office. The American College of Physicians has an excellent climate change toolkit, an advocacy toolkit that includes lots of brochures and leaflets and talking points for your patients on climate change and health. And finally, the My Green Doctor program that we developed at the Florida Medical Association that's available at 2 websites, mygreendoctor.org and My Green Doctor ES in Spanish. So what are the sustainability topics for medical practices? Well, it's kind of what you expect, saving energy by looking at those thermostats, adjusting your lighting, using computers wisely, choosing appliances, and even adopting renewable energy, either by purchasing it from your utility or maybe even putting solar panels on your own roof if you have a suitable roof. A great financial benefit if you're going to be in the building for 10 years or longer. By looking carefully at the things we buy, reusing, recycling, and getting rid of products like styrofoam that we just don't need. By healthy food choices, encouraging healthy foods for your staff, healthy for the staff, healthy for the patients, and healthy for the environment. By how we use chemicals, our cleaning products, pesticides, and even the chemicals we use outdoors if you have a garden around your facility. Through water conservation, by looking at transportation options for the staff and maybe the patients. Some offices even putting and making money by putting electricity charging stations for electric cars in their parking areas. And finally, through patient education. So we're going to spend a couple minutes on the My Green Doctor program. This is a complete environmental sustainability practice management program. As I said, it has two websites, mygreendoctor.org, and in Spanish, mygreendoctor.es. In 2022, the website had more than 15,000 users from 80 countries, and currently 28 health professional organizations provide My Green Doctor to their members as a free membership benefit. I hope you'll consider recommending it to your organization. My Green Doctor is comprehensive, science-based, non-political, free, and very easy to use. It's for any outpatient clinic, practice, or center, and most offices save money in the first month using the program. These are the 28 participating organizations that provide My Green Doctor to their members as a free membership benefit. Florida Medical Association that created My Green Doctor, but also the World Medical Association, the American Academy of Family Physicians, the American Academy of Dermatology, and many, many others. How do you get started? Well, I encourage folks to go to the homepage at mygreendoctor.org and watch the 3-minute video to learn how easy it is to add just a few minutes of My Green Doctor to the agenda of each regular office organizational meeting. Maybe your practice meets once a month to talk about business issues like billing and scheduling and complaints. Add 5 minutes of My Green Doctor. Maybe your practice huddles every day or once a week. Add My Green Doctor once a month or every 2 weeks, just 5 minutes. You can also click on the website to register or sign in, or even to donate to our foundation if you support this kind of work. The website is large, but I just want to point you to one other resource. This is going to the homepage. You'll see at the top the Green Team Guide, and pull down from there to reach the meeting by meeting guide, which is the core of how to use this particular resource. The meeting by meeting guide is a complete script for each clinic management meeting. So you'll add 5 minutes to each business meeting agenda, 5 minutes of My Green Doctor, perhaps once a month, but there'll be a complete script at the meeting by meeting guide that explains exactly what to say and do at each meeting. There's really nothing for the office manager or you to study or prepare. The meeting by meeting guide focuses on slow, steady improvements. We want you to just take on one small project each month, just one small item, but over a period of months, you'll look back and realize you made a substantial change and saved money, honestly, for your practice. Patient and staff teaching are emphasized, and the staff particularly enjoy this. My Green Doctor encourages discussion and staff involvement and provides a Green Team notes form for easy record keeping of your progress. There are lots of teaching resources you'll find at My Green Doctor, and the other resources that I've shared with you. The Your Healthy Home brochures are for patients on climate change, how to protect your family, surviving extreme heat, air pollution, and wildfires in a changing climate, protecting your family, health eating for your family and the environment, and even green cleaning. And you can even give patients this QR code so they can read the brochures online at home. And all these resources from mygreendoctor.es and mygreendoctor.org are available in Spanish. What sort of other resources will you find at My Green Doctor? Well, once you finish your first year of environmental sustainability, you'll go to the 7 My Green Doctor workbooks with more than 120 action steps as you continue with your journey on the topics you'd expect: energy efficiency, renewable energy, water efficiency, solid waste and recycling, drug disposal and chemicals, transportation and commuting, and healthy foods. If you dig in more deeply, for example, into the Energy Efficiency Workbook 1, you'll read about energy audits, greenhouse gas calculations, topics on office lighting, office equipment, heating and air conditioning measures, windows and insulation, and managing hot water. So let's go more deeply into office lighting and see the topics that you'll find. Topics like practicing turning off lights at night, using compact fluorescent light bulbs and the low-emitting diode bulbs, proper discarding of fluorescent bulbs, installing T85 efficient fluorescent fixtures, using task lighting, installing motion detectors. If you're a big organization, hiring an energy consultant, which can save you lots of money, teaching your staff, teaching your patients, and offering free office brochures. So some of the many topics you'll find in the workbooks. Okay, we're almost done. Environmental sustainable medical practices, those vanishing barriers to going green. We've talked about how maybe sustainability can be part of your mission, one of your core values, that maybe we're busy, but adding 5 minutes of My Green Doctor or another resource to your monthly office meeting isn't really so difficult, and that there are benefits to go with it. Too expensive? No, it will cost you nothing and honestly save you money. There's no one to lead us. Well, you don't really need a leader. You just need the Meeting by Meeting guide or one of the other resources to guide your 5-minute sessions. Our practice leaders aren't interested. Well, maybe you're one of the leaders and you can get others interested to put it on the agenda of your practice meetings. We don't know how. Well, we've now given you resources, so it just isn't very difficult. How are we going to get started? Well, getting you started today, 5 steps. I'd recommend registering at My Green Doctor or any of the other resources that I've shared with you today. If you use My Green Doctor, try the discount code MGDAMA, My Green Doctor AMA, register as a partner level member, and all the resources of My Green Doctor are free to your entire practice forever, saving you $400 the first year and $60 a year thereafter. Ask your leadership to add 5 minutes of My Green Doctor or of one of the other resources to each practice meeting. Just 5 minutes. Don't be more ambitious than that. Slow, steady improvements are your goal to let your organization move in the direction you want to go. Provide your patients and staff with brochures, posters, and many, many other teaching tips that you'll find at these resources. And finally, commit. Commit to a goal of qualifying for the Green Doctor Office Recognition Certificate, which will be free from your Health Professional Society. This is an example of the Green Doctor Office Recognition Certificate. This was awarded last year to a gynecology practice in Greece, for example. Okay, what are the sustainability and climate change roles for physicians? Well, be informed. Take advantage of CME courses such as this, and look at those articles in your medical journals that are becoming increasingly present, talking about climate change, its threats to your patients, and what you can do to identify and teach your patients at risk on topics like heat illness and extreme heat events, extreme storms and flooding, wildfires and air pollution. Be prepared yourself, be prepared as a practice, and prepare your community. Advocate for vigorous and national and local planning to prepare for these events, and also to have a plan in your community and in your nation to roll up our sleeves and rid ourselves of fossil fuels for energy use in America. Urge your professional societies to engage. If your society has a climate change or sustainability committee, join it. You'll meet many remarkable people excited about improving this world. And if there isn't a sustainability committee, ask your leaders to start one or start one yourself. And I can help you with that if you're interested in learning how to go about it. And finally, add sustainability to your hospital, if you're hospital-based, or use the resources that we've talked about today to do this in your practice. I want to remind you of those free online resources for practice managers and physicians, the Royal College of General Practitioners Green Impact for Health, the Climate Change Toolkit from the American College of Physicians, and finally, My Green Doctor from the My Green Doctor Foundation and the Florida Medical Association. Okay, my last slide, greening your practice. How to start today? Well, pick a resource or resources and consider registering at mygreendoctor.org with that discount code MGDAMA and watch the 3-minute video to get started. Ask your practice manager to add 5 minutes of Migraine Doctor or any of the resources we discussed to each monthly office business meeting. Just 5 minutes. You can do this. And hospital-based, do join your hospital sustainability committee. You'll meet some remarkable people, and I assure you this will enrich your experience as a physician. I want to thank you, and now we have some time for your questions and ideas. I turn this over to Mr. Michael Tuddy with the AMA. Thank you.
Thank you, Dr. Sack. Appreciate the presentation. I'm going to start off with what I think many people might be thinking about, which is I'm in a busy practice. I'm struggling just managing day-to-day issues of seeing patients or managing my practice, dealing with reimbursement issues, staffing issues. You know, I think this is important, but why would I add this to my already full agenda? Why would I make this a priority for my practice in light of all the other practice burdens many people are facing each day?
Well, it's a great question. We are all very busy in our practices, and I'd like to answer in 4 ways. First of all, this will save money for your practice with no financial investment. Second, this is something that your colleagues in the practice will enjoy doing. The staff, your employees are going to be proud to work and pleased to work in an office that adds sustainability to one of the things that they do. Your patients will be impressed and maybe even take advantage of some of the ideas you provide to them. And finally, I think it's going to be enjoyable. It's not a big burden, and it's something that as you walk through your office months from now, you're going to say, wow, I like this. I'm just pleased to work in this office that I helped improve.
You talked a little bit, Dr. Sack, about why you don't like green teams, about creating a separate initiative, but really embedding these concepts into your day-to-day practice management. Can you explain a little bit more why you think that is and why that creates more traction to create change in your practice versus getting 1 or 2 dedicated individuals to create like a separate team?
You know, the goal is an enduring, sustainability program. And when we segregate a small green team to do this, it just peters out. Let sustainability, environmental stewardship be one of your core values, something you can feel proud about, you can brag about, and it really does begin at the top. The leadership of the organization should make this decision. Hey, we can do this. This is going to be fun. We'll probably save a little bit of money. The bottom line, it's worth doing. So make it a core value, make it a policy of the organization, and move forward and enjoy it.
What are some of the examples that you have seen, some of the areas where people have implemented in practices that have had some of the biggest impacts from your discussions with many practices? What types of interventions have you seen have some of the most success?
Well, we want to begin with the low-lying fruit, which is energy use, which is electricity. And so often you walk through your office at 5 o'clock and all the lights are on, and all the computers on, and all the machines are on. So just getting a habit of turning off equipment that can be turned off is the biggest saving. And so that's the big one. People begin to look at the chemicals under the sinks used to clean up their practices and discover toxins that they didn't need to expose their colleagues to. And then they do things that may not save money, but feel good and maybe have an impact, such as recycling, putting those recycling bins in the waiting room. And finally, the public relations and honestly, the health benefits of leaving literature for your patients and your staff so that they can make wise choices at home. These are the kind of first 4 areas that practices work on.
Yes. And we have a question from the audience. And for those who are participating and want to take a chat or put something in the chat box, that would be great. But there's a question around, you talked about a lot of the, it was an interesting graph that a lot of the pollution is actually from the things we buy and the resources that we bring into the practice versus what I think is scope 1, the actual energy use within the practice. Are there resources available, or do you see that coming down the road where people who are doing procurement for their practices can start to make judgments over things that actually are better for the environment or worse for the environment, all the way down to even things like pharmaceuticals that we might be that physicians may prescribe to patients?
The answer is no. There is not a clear resource either for hospitals or for our outpatient lives that we can go to and say, hey, I'm going to buy from this vendor. It's something that you're working on at My Green Doctor. We're creating a resource that should be out later this year. But also the research hasn't been done to look at a granular level of how we make these choices about a product's manufacture, transportation, and disposal. So these resources you're going to see in the years ahead, they're not there yet. But for now, we have a lot to do without that. We can work on energy and our chemical choices and others. So let's get started and then look for those resources in the months, years ahead as our sustainability program really gets underway. I hope that answers the question.
Yes, there's a question that just came in too from a medical student who wanted to know about bringing this forward, or even whether you're a medical student or maybe you're just a staff person who's participating today and you're thinking about how do I bring this forward, whether it be My Green Doctor and other resources, how can I be sort of the agent of change within my organization or institution?
Wonderful question. I'm so happy to hear that. Yes, in the clinics where you're training, talk to your mentor or talk to the practice manager. Ask them if they have a sustainability program. Even if you're only there for 4 weeks, you could attend one of their practice meetings and introduce these ideas, the My Green Doctor resource or one of the others, and plant a seed that you can leave behind after you leave that site where you're training. Yeah, please do. And then remember it when you get into practice. These resources are available for you.
Yes. How quickly can practices, I get sort of a question around implementation, and if I'm a leader and I've sold it sort of as financial savings, is that something that I'll see out a year or 2 year, or can a practice see financial savings in the 60 to 90 day period?
Certainly in the 60 to 90 day period. So at My Green Doctor, we recommend going slow, not to push it. In fact, the first meeting by meeting guide, at the first meeting, you're just going to talk about the concept of sustainability, and you'll read 10 reasons to go green. You'll make no decision. Don't rush it. You're setting a pace, slow, but a tone of this is one of our core values. Meetings 2 and 3, you're going to dig into the energy topic and save money. And then 4 and 5 and 6 into more and more topics. But yeah, in the first 60 days, you'll save money, almost certainly.
There was a question too from the medical student that I don't know if you and I could answer, something I'll have to investigate. How should we think about this as part of a medical student's education and their competencies, understanding the environmental issues and the practice of medicine? So that's definitely a future thinking topic. I don't know if you have any thoughts about that, Dr. Sack.
Oh, yeah. Most medical schools are beginning to look for ways to add climate change and health and sustainability into their curriculum. It's beginning to happen at many medical centers with electives. A few are talking about how to get actually into the curriculum, and I can share resources with you if you'd like on a number of projects and a number of medical schools working on this. Lots is going on.
That's great. Someone wrote in and says, my 10-year-old practice has non-volatile adhesives, motion detector in the room for lights and the entire office lighting, non-volatile cleaning under sink, non-refrigerated water, low flush toilets. What would be the next big thing for that practice to take on?
Well, the next thing what you should do is take credit for it and get a certificate from My Green Doctor, because you've done great work, and then something you can brag about. I didn't know if I heard about recycling. I don't know if I heard about urging healthy food choices or transportation options. You're ready for the next level of approach, and I'd be happy to help you with that if you'd like.
Wonderful, wonderful. So where do you think this space is going? I mean, obviously, in the last number of years, environmental issues, and I have a lot of empathy for our colleagues, anybody who's joined from California who may be experiencing some tremendous rains and floodings there. Is this something that you think is going to be more common, more front when it comes to sort of what we're going to see from healthcare institutions? And how do you think also in recruiting employees and people to your practice, does this, you think, helps in that place? And are people going to be looking to join organizations that, have a green focus or, aware of and addressing issues around the environment?
Let me answer it in 2 ways. From the level of the climate change disasters we're all facing, every part of the nation now is affected. And because of that, we as health professionals do have a professional requirement to be aware of these risks to our patients, and honestly to teach them. So although this is going to be a small component of your practice, if you're teaching about diabetes management and high blood pressure and depression and aches and pains and all things we do in our practices, still we have to be aware of this threat to our patients and be informed so we can prepare them when necessary. On more the sustainability topic, we all feel we have a responsibility to do something. And we begin at home, in our own practices, in our own homes, and in our own hospitals. So yes, this will be a small but increasing part of what we do as health professionals, to be concerned about sustainability and the climate, honestly. Should our health professional societies help us with this? I hope they will, because we can't do this alone. And to the extent that we have CME programs, offer resources like Greener Practices or Healthcare Without Harm or My Green Doctor, our health professional societies have a role to help us make this easier for us to do.
What are your thoughts about these types of policies being written into sort of Joint Commission or other sort of formal credentialing or reviews that institutions and practices go through?
It's beginning. I'm very proud of the American Medical Association for having adopted really outstanding model policies on this. For example, the American Medical Association has asked the Joint Commission to look at adding climate change and health into the curriculum of medical schools at all levels of training, medical school, postgraduate level, and even in CME programs. So it's starting to happen, and American Academy of Pediatrics, American Psychiatric Association, ACP, others have made similar requirements and requests that this be one of the projects we take on as an institution of healthcare.
Before we close out, Dr. Sack, any final words or recommendations for those who were intrigued by the data you presented, maybe alarmed at some of the photos you presented, particularly the one about the plastics in the ocean, which is frightening to say the least? You know, what should we do starting tomorrow or Monday in our practice?
You know, I just want to say sustainability doesn't have to be difficult. You know, this is really work that your office manager and team does, but doesn't have to be them either. Go about it as something joyous, interesting, that'll enrich everyone's experience in the practice. I think you'll look back 6 months from now and say, wow, we're doing something neat in a small but important way, and be proud of it. So get started, talk to your leadership, and have fun with it, truly.
Well, thank you, Dr. Sack. We're out of time. We appreciate your expertise today. To wrap up, we want to remind the audience to check out the suggested content located in the resources widget, including the availability of today's slides. For additional resources to support your physicians and staff during this time, please visit the American Medical Association website or stepsforward.org, or any of the resources that were presented today. At the conclusion of today's webinar, a brief survey will pop up in your window. Please take the time to answer the questions. Your responses help guide our upcoming programming to deliver webinars you want to see, such as the one you saw today. To our participants, thank you again for joining us. We hope to see you again soon in another webinar. We appreciate your time. Be well.